Thank you, and with that, I will pass it over to Dr. Traub.
Thank you, Dr. Alexander Scott, and thank you for your leadership through this ongoing crisis. So our emergency departments in Rhode Island now really are stretched to the breaking point. And I think one of the reasons, the biggest reason that we've gotten there is that nationwide shortage of medical staffing, particularly nurses, that we're feeling acutely in Rhode Island has caused us to close beds within the hospital and also to close beds within the emergency department. This problem is really exacerbated by the fact that without inpatient beds, we have to board our admitted patients in the emergency department, which reduces our access to beds and to be able to care for people even more. So I wanted to mention a couple of things that I think that we can all do to try to help our state get through this winter. First and foremost, please get your COVID vaccine, get your influenza vaccine, and when you can, get a booster. It's the best thing that you can do for yourself, for your family, for your community, and for our state. Number two, if you need unscheduled care, please call your primary care physician or an urgent care. They will be able to provide outstanding care to you and try to take some of the strain off of our emergency departments. Number three, please keep your regularly scheduled doctor's appointments. The best way to keep a small problem from becoming a big problem that will bring you to the emergency department is to make sure that you keep up with your scheduled care. Finally, if you need emergency medical care, realize that the emergency departments within Rhode Island are open and we are here for you. But I would like to point out that if you come to the emergency department, you are likely to experience significant waits. At this time of year at Rhode Island Hospital, we would normally have 60 to 80 beds open to be able to care for patients. And some days we may be down to a dozen or less. Finally, I'd like to close with reminding everybody to please, when you come in, please be kind to the nurses, the technicians, the registration personnel, the security, the physicians, and everybody in our healthcare setting who's trying to take care of you and who's showing up to try to help. We realize that your waits are long and we realize that you will be frustrated, but we ask that you remember that we're on your team and we're here to take care of you. So with that, I'd like to stop and I'd like to introduce Dr. Pari Gopalakrishnan, the Interim President and Chief Operating Officer of Kent Hospital.
Thank you. Good morning. My name is Pari Gopalakrishnan, and I'm the Interim President and Chief Operating Officer at Kent Hospital. I want to thank Rido and Dr. Alexander Scott for putting this together so we could share with our community the challenges that we all have been facing in our hospitals in the emergency departments over the past few months. Our hospital has 47 emergency room beds, and many times over the last few months we've had 60, 70, 80, 90 patients waiting and trying to be cared for in our emergency department of 47 beds. So this results in patients waiting a really long time, much more than we would like. Our dedicated nurses, staff, physicians, advanced practice providers are working diligently to care for these patients. To address this crisis, we've done a lot. We've put up a military-grade tent in our parking lot to add 10 more beds to care for these patients. But the challenge is still the same. It's staffing. We have a hard time when our staff is already short and working very, very long hours. But we do our best, and they come every day to care for our patients the best they can. I want to share a few examples of some really courageous staff members that I have at our hospital. Sarah Sullivan, Cheyenne Copel, they're two nurses in our emergency department. Sarah got off a plane on a vacation and came straight to our hospital because we were short-staffed to work. Cheyenne, same thing, nighttime, will work doubles. If we're short, she'll come in. They're just two examples of many, many, many healthcare workers right now that are working much more in different shifts than they are expected to do despite their challenges at home and family. They are committed, and that's one of the things that I encourage you, as Dr. Traub said, when you do come and decide to get healthcare, be kind to your healthcare workers. They are working long, long hours, understaffed at this point. So what can you do? What do I ask of you? It's very simple. I think number one, vaccines work. Please get your COVID shot and your COVID booster. Get your flu shot. I have 5 children. 4 of them are eligible for vaccines. All of them have been vaccinated. I want you to know that. I think come to the emergency department if you think you have an emergency, but recognize there are a lot of alternative options. Our PCPs in our community are, have opened up many hours to see same-day patients when people are sick. So reach out to your primary care doctor any time of the day to see, is this something that you need to go to the emergency room for? There are many other options. If you don't have a primary care doctor, let us know and we will find you one. There are express cares, urgent cares, telehealth. There is just an ample amount of opportunities to take the lower acuity illnesses that need to be seen and take them to another area so our emergency departments can be able to care for the sickest of our sick that come in there. Again, thank you for giving me this opportunity to speak on this. Thank you. I'd like to introduce James Rajat, the Chief Strategy Officer for EOHHS.
Good morning, everyone, and thank you for having us here today at this wonderful event, and thank you, Director Alexander Scott, for inviting EOHHS to participate. My name is James Rajat, and I serve as the Chief Strategy Officer at the Executive Office of Health and Human Services. As part of my role, I'm working to help co-lead this interagency team from the Health and Human Service Agency perspective to respond to this ongoing challenge. First and foremost, I would be remiss if on behalf of Secretary Wilma Zeta-Jones and Assistant Secretary Anna Novice, that I did not thank all of you who are providers who continue to provide tireless care and quality care to all of our families here in Rhode Island, despite oftentimes the toughest of situations. In talking to providers myself, and in talking with our health system partners here today, it's become abundantly clear that hospital capacity and overcrowding is a top concern for our state. As we know, hospital overcrowding stems from several following key concerns. First, we know there are hospital capacity challenges that exist, including the high numbers of walk-in patients mentioned today, increased hospital diversions, forced hospital openings, creating additional stress, as well as limited inpatient capacities, as you've heard from our physicians. Behavioral health challenges is second. There are bed and staff capacity limitations that exist. There are higher volumes of behavioral health patients arriving, oftentimes with more severe and more complex illness. There are delays in our discharging, and there are also a lack of emergency treatment for behavioral health within our emergency departments, and early initiation of that treatment. Third, we know we have underlying workforce and system issues to address. These challenges include burnout, as the director mentioned, shortages in aging workforce, increased retirement post-COVID, and provider onboarding challenges. Lastly, we know there are other confounding factors that affect this situation. We have the current COVID-19 public health emergency. We have a worsening overdose epidemic. We have the presence of other illness such as flu, as mentioned today. And we have the lack of appropriate housing for all of our residents, all of which create the situation that we are here to address. At EOHHS, we formed an interagency team across all of our health and human service agencies to convene and review these challenges and to assess our opportunities for solutions. We've implemented some immediate relief and are planning long-term strategies to address this as we continue throughout the coming months. Some of our activities include additional public messaging, like the press conference here today, additional information for our providers on how to help patients navigate the system, emergency regulations to assist with increasing our workforce and pre-hospital transportation availability, partnerships with our urgent care and other clinicians to develop capacity to expand emergency care alternatives, development of step-down capacity for our behavioral health care, and increasing treatment initiation, as I mentioned earlier, within our emergency departments, provision of staffing supports, specifically including workforce recruitment and retention for our direct care workforce that deliver home and community-based services. Lastly, we're also planning for mobile crisis response for our behavioral health system and increasing our behavioral health system capacity through the provision of certified community behavioral health clinics. As you all mentioned here today, this is a super complex issue. And as I mentioned earlier, it requires interventions that span the entire human service delivery system. This is a system response that is needed. And that's why we have a system of individuals and partners here that have convened to continue to address this.